Well, doctors say there is a mental health crisis among children, some as young as 10 years old.
And in tonight's Family Focus, one local father is using the death of his son to encourage others to not suffer in silence. Fox 44's Reggie Marion shares his story.
Jesse Lee Randall was a vibrant student at Santa Maria High School. He made good grades and enjoyed playing sports.
He had friends galore because he was the life of the party, always joking, and he was involved in baseball.
His father, Alan, says Jesse later started suffering from depression. Alan knew something was wrong, but says he couldn't find the right thing to say.
I didn't know what to say other than, "Are you going to be okay?" You know, and I should have said, "Son, this is tough. You don't need to try to handle this on its own. Let's get you some help."
Alan thought Jesse would get through it over time, but in 2015, Alan lost his son, who he also called his best friend.
April the 5th, I saw him. That was Easter Sunday, and we talked about it, and we hugged and everything. When he got ready to leave, like he always does, he gave me a big hug. He said, "I love you, Pop." I said, "I love you, son." And he got in his car and drove away. And 2 days later, he took his life.
Jesse was 24 years old. Alan received help dealing with the loss from the Louisiana chapter of the American Foundation for Suicide Prevention. He now encourages other parents to take action.
Talk to a counselor, find somebody to talk to.
Research shows mental illness is the third leading cause of death for ages 10 to 24. According to experts, students face 3 mental health challenges: the transition from summer break to school mode, in-home situations such as family issues or abuse, and building relationships.
Trying to fit in, dealing with puberty, dealing with bodily changes, all while trying to find themselves. And so what they need is support, and they need to see those relationships modeled in healthy ways.
Social worker Shamaya Howard says it's important to pay attention to your child's behavior,
such as the child not being interested in things that they usually were interested in, them not being able to socialize, make friends, acting out, fighting, being angry, paying attention to their patterns, their eating habits, their sleeping habits.
Children often suffer in silence. Be sure to ask the right questions to get them to open up.
Instead of asking, "How was your day today?" ask them, "What was the best thing about today?" Or ask them, "If you could change one thing that happened today, what would it be? Who do you wish you could sit by? Who do you hope that you never have to sit by?" And you always want to follow that up with why.
They're the key to our future. So, you know, communication and interacting with them with their homework, get involved with them and see what's going on with them, because they're not always going to tell you, and they're not always going to tell the teacher.
Alan says Jesse loved helping others. He had a tattoo that said, "For you, I will." After his death, Alan inked those same words. It's his commitment to mental health awareness and pushing others to get help.
I will tell his story till the day I die.
Reggie Marion, Fox 44 News.